Hello and welcome to Session 1 of the Think Brain Health Symposium, which is on the subject of health promotion and clinical risk management. My name is Alastair Noyce, and I'm a reader in neurology and neuroepidemiology at the Wolfson Institute of Preventive Medicine, Queen Mary University of London. I have the great privilege of chairing the Think Brain Health Initiative, along with my co-chairs, Professor Philip Sheltons from the University of Amsterdam and Professor Gavin Giovannoni, also of Queen Mary University of London. I hope you are looking forward to the talks that we have planned for you over the next two sessions, which come from some of the leading lights in the areas of brain health, public health, and neurodegeneration. I would like to open this first session by reminding everyone about the close ties between the heart and the brain, metaphorically in this picture, but also tangibly. Aside from the anatomical links, the heart and the brain are connected through many determinants of disease and also through many determinants of health. Prevention of cardiovascular disease is one of the great success stories of the modern era, but despite common determinants of both health and disease, the same success cannot be claimed for the prevention of age-related diseases of the brain. The Think Brain Health campaign is all about shining a light on the opportunities for prevention of neurodegenerative brain diseases and the promotion of brain-healthy approaches. The Think Brain Health campaign was preceded by our team spending 18 months developing a policy document called Time Matters, a call to prioritise brain health. In that policy document, we outline a range of recommendations which I will go on to mention, but first, let's think about what it is we are trying to prevent. The two main neurodegenerative diseases that threaten brain health as we age are dementia due to Alzheimer's disease and Parkinson's disease. This picture describes some of the symptoms of these two conditions. Of course, there are other neurodegenerative diseases, but as the big two, these are the ones that pose the greatest threat to healthy brain aging. One thing that is common to all neurodegenerative diseases is that the pathological process begins long before the signs manifest. As such, there is a broad window of opportunity to intervene before disability occurs. This figure outlines that concept. Here, at-risk individuals are defined as those that do not have the disease, but may have been exposed to initiating events. Pre-symptomatic individuals are those in which pathological changes in the brain have begun, but there are no outward signs or symptoms of disease. Individuals that are in the prodromes are those that have signs or symptoms reflecting underlying pathology, but these are insufficient for a diagnosis. And the clinical phase of the disease is when the threshold for diagnosis has been met, and the disease may or may not have been diagnosed. In each of these phases of neurodegeneration, there exist opportunities to intervene which, depending on the stage, constitute primary, secondary, or tertiary prevention. Let's take dementia as an example by itself. The global impact of dementia is huge. In 2016, 3.5% of all global deaths were attributable to dementia, including Alzheimer's disease, and this is predicted to rise to over 7% by 2060. In that way, dementia is already the fifth highest cause of death worldwide. The global costs of dementia are staggering, having increased from $600 billion in 2010 to over $800 billion by 2015. But despite this increasing burden of dementia and the eye-watering costs associated, there are reasons to be optimistic. For example, this study using data from England and Wales, spanning from 2002 and projecting forwards to 2040, suggests a flattening off in the case numbers of dementia over time. The increases are so far thought to be largely due to prolonged survival from other diseases and an aging population. When we adjust for that effect of age, there is actually evidence to suggest that the age-standardized prevalence of dementia in both men and women is in fact falling. Put simply, whilst overall case numbers of dementia are rising, it appears that the aging population is the biggest driver for that, and actually when you take account of age, case numbers overall tend to be falling. Importantly, these observations have been made in several settings around the world now, and suggest that something we are doing has the potential to reduce the burden of dementia over time. The most likely explanation is that something is being done in primary care or public health, perhaps with another focus, but it is having an effect. I should mention that the same is not currently true for Parkinson's, and the burden of Parkinson's disease appears to be rising even after we take account of age. In spite of evidence from around the world that the age-adjusted prevalence of dementia is falling, there is still a lack of understanding in the general population and amongst healthcare workers that any aspect of dementia is preventable. Look at this figure from Alzheimer's Research UK Dementia Attitudes Monitor from 2018. Whereas 81% and 77% of responders felt that there was something to be done to prevent diabetes and heart disease, respectively, only 1/3 of respondents think that it's possible to reduce their risk of developing dementia. In fact, the latest suggestion is that up to 40% of dementia is explained by potentially modifiable risk factors. It is essential that these messages make it through to the public and healthcare workers in primary care. The WHO recently published guidance about reducing the risk of developing dementia. This includes recommendations to increase physical activity, improve nutrition, maintain cognitive activity, manage weight, control diabetes, minimize depression, stop smoking, reduce alcohol, increase social activity, reduce blood pressure, control blood lipids, and minimize hearing loss. Many of these things we recognize from public health messages around healthy aging and reducing cardiovascular disease. It is probably worth mentioning at this point that no similar guidelines exist for Parkinson's disease risk reduction, and this is concerning given what I've said about the apparent sustained increase in Parkinson's burden, albeit still well below the current burden of dementia. It seems appropriate in the year 2020 to have a slide about pandemic preparedness, and the term pandemic has become a household word. It is not inappropriate to think about neurodegenerative diseases as grumbling and an evolving global pandemic. Currently, health systems are not equipped to manage the large numbers of people potentially at risk of neurodegenerative conditions, but as I have said, there is a window of opportunity for intervention. If we have learned anything in 2020, it's that we must prepare for pandemics and do everything possible to reduce the impact on lives and the burden on healthcare systems. Various lines of evidence already point towards limiting success in reducing the burden of disease, possibly inadvertently through primary care and public health policy, but with an alternative focus. In general, public understanding is poor, and there is a lack of engagement among healthcare providers despite these signals of improvement and a greater understanding about the modifiable risk factors and strategies for promoting brain health. It is important to remember that dementia is not an inevitable consequence of aging. Whilst more research is needed, there are already things that can be done right now. To this end, we developed the Time Matters report. This involved convening an expert group to develop evidence-based recommendations and a call for action encouraging positive behaviour change and policies to promote brain health, working towards the prevention of neurodegenerative diseases. We divided our recommendations under the following headings: health promotion, clinical, and research recommendations. I will summarise the recommendations under the first two headings as part of this first session, and then in tomorrow's session we will cover the remaining recommendations. Under the heading of health promotion, we called on policymakers and public health bodies to act on the following: to protect and provide public health budgets, to encourage behaviour to improve brain health, to support and empower individuals to make lifestyle changes, to prepare for an increasing appetite in risk information, including genetic testing, and to provide access to available and effective treatments. Alongside, we also coined the phrase, "What's good for your heart is good for your brain," to acknowledge the fact that we're already starting to see the benefits of good cardiovascular health on reducing the burden of brain disease. Just imagine what might be achievable with a focused public health campaign around brain health. For the clinical recommendations, we advise that healthcare professionals and administrators play a key role in the management of people with or at risk of neurodegenerative disease, and that they should act on two clinical recommendations. The first is to refer to specialist or multidisciplinary services when suspected of having a neurodegenerative disease, and to provide follow-up with ongoing, widely available holistic care, including prevention information, treatment options, and support. Building on the Time Matters report, we now have a whole campaign and mission around improving healthy brain aging. We want to promote public understanding that preventing brain disease is possible and what's good for the heart is good for the brain. We want to prepare healthcare professionals to manage people with or at risk of neurodegenerative brain disease. And finally, we want to prioritise research and build infrastructure to enable prevention, early detection, and the management of neurodegenerative brain disease. A very important aspect of our work is based on the principle that good brain health should be encouraged to all. We must be careful not to advantage specific groups with health education or health promotion advice. We must be mindful of this as we move forward, acknowledging that public health campaigns often tend to benefit some groups more than others. Technology has the potential to broaden opportunities, but at the same time poses the risk of increasing inequities, and we must work hard to mitigate this risk. Finally, we must be mindful about the effect that the COVID-19 pandemic has on risk factors for disease, the impact it has on brain healthy approaches, and our ability to undertake research and develop interventions. We have been very busy with the Think Brain Health campaign and the Time Matters policy report over the last year. We launched our Think Brain Health initiative website earlier this year and our social media presence on Twitter and LinkedIn. We launched the Time Matters report at the European Health Forum in Gastein last year and have had several appearances on BBC Radio, a blog in the British Medical Journal, and presentations at many of the big, albeit mainly virtual, conferences over the course of this year. On this slide, I want to acknowledge the authors of the Time Matters report on the left and the current members of the Think Brain Health Steering Committee on the right. What we are missing currently is a representative from primary care, and we would welcome any expressions of interest for this role. We've garnered plenty of support and endorsement as we've moved through our first year with the Time Matters report and the Think Brain Health initiative. Here I have listed our endorsers to whom we are very grateful for their support. We would, of course, welcome further endorsement of our recommendations from other policy and advocacy groups and other stakeholder groups. So please get in touch if you would like to discuss this. Now let me introduce our excellent speakers today. Nahid Mukaddem from University College London, talking about the potential for dementia risk reduction and how to make it more equitable. Frank Jessen from University Hospital Cologne, talking about supporting healthcare professionals to manage an increased population with or at risk of neurodegenerative brain disease. And finally, Charles Alessi from Public Health England, talking about brain health in the age of precision. At the end of these talks, we will be doing a question and answer session, and I hope that you will join us for this. I want to thank you for your attention. I want to thank Oxford Health Policy Forum for all their support in producing the Time Matters report and setting up and running the Think Brain Health campaign. I hope you enjoy the rest of the talks over these two sessions.